up and running. Well, hello and welcome again to another episode of RT Matters, where candid conversations take place about what matters most to respiratory therapists. I'm Patrick Dunne, your host, and we're delighted to have you to join us for another episode of RT Matters. And just a reminder, this as well as all prior episodes of RT Matters are available through your podcast app of choice. It's open access, no charge, no subscription fee, no membership. So let your fellow RTs know about us. Now on to the topic for this particular episode. I'm delighted to welcome someone who I've worked with in the past. This is basically going to talk about the credentialing. In other words, you as a respiratory therapist probably first had your exposure to the NBRC when you had to get your licensing exam taken care of. And you either did positively and got your license or you had problems. Well, we're going to talk more about the NBRC because they also offer specialty credentials for credentialed RTs that have a great impact on your career, which we'll hear. And we want to find out who wants to do that. What's the advantage to your career? What's the advantage for employment opportunities? What's the advantage for your professional profile? Well, today our invited guest is going to be able to explain all that as we drill down on the National Board for Respiratory Care, which is our premier credentialing operation recognized around the world for respiratory therapists. Joining us today is Lori Tinkler. Lori is the executive CEO, I should say, of the National Board for Respiratory Care located in Overland Park, Kansas. She has her MBA, but she's also one of 300 people who has a certified credentialing professional certificate that is offered by the Institute for Credentialing Excellence. I kind of tell people that's like the AARC for respiratory therapists. This is the organization that people like Lori, who hold executive positions in credentialing agencies in healthcare, aspire to maintain their excellence in terms of doing the right thing the right way. Lori, welcome to RT Matters. We're delighted to have you with us today.
Thank you, Patrick. I'm excited to be here.
Yeah. Well, let's talk a little bit about the NBRC. I told you earlier that I'm a former trustee, but it was way back in the dinosaur ages. But a lot of it has happened that the NBRC was established in 1960, and 66 years later, you're still going strong, stronger than ever. How many credentials has the NBRC issued during those 66 years?
So in those 66 years, we've awarded 576,391 credentials.
Talk about specific.
Yes, that's very specific. To nearly 300,000 practitioners. So many practitioners hold multiple credentials, which we'll talk about later when we talk about specialty credentials.
About how many credentials does the NBRC offer in a year right now?
So we're awarding about 15,000 credentials annually currently. And I expect that number will climb back up. We've ebbed and flowed. We know we've had a decline in the number of people entering the profession in the last several years.
Yeah, they say 10% of the programs are full. So
a bit, but we're starting to see an uptick. Graduation season is upon us. I just looked at numbers last week for applications coming in, and we are ahead significantly of where we were last time this year. Last year at this time.
So your efforts, and I should also point out that the NBRC is in a collaboration with both the AARC and also COARC, which is the accrediting agency for schools, to try and say we need more RTs. So that program is obviously starting to pay dividends. And I think that's a nice testament to this cooperation that we're doing.
Yes, we are very excited about the More RTs platform and what it's doing to promote the profession and create public awareness.
Okay, let's talk a little about how the NBRC is organized. It's an organization, it's external, it's self-standing, specifically the sponsoring organizations and the so-called Board of Trustees. What are the sponsoring organizations?
So we have 4 sponsoring organizations: the American Association for Respiratory Care, the American College of Chest Physicians, the American Thoracic Society, and the American Society of Anesthesiologists. Those organizations nominate individuals to serve on our board.
And so you have 3 physician groups and 1 respiratory therapy practitioner group. How many trustees are nominated by each sponsoring organization?
So we have half physicians, half respiratory therapists. So the AARC nominates 9 individuals, and each of the physician organizations nominates 3.
Okay, that's 18, but your board is 19. What's the other person that's on there?
So we also have a public member who is elected by our board to serve and really provide the external perspective, the consumer perspective to the board. Someone who's not in healthcare, someone who really comes from a different discipline, but has experienced healthcare either as a patient or as a family member, but external to working in healthcare.
I suspect that's one of the requirements you maintain as your organization's accreditation certification, that you have a public member and it's not just exclusively people who are in the domain.
Correct.
Okay.
So the NCCA, who we're accredited by, requires that we have a public member.
Got it. Now, it seems like an awful lot of work for 18 content specialists and one public member to do all those exams. What resources do they have access to, and what support do they have?
So first and foremost, we have a 21-member staff team that supports the board and their efforts to develop the examinations. We have an in-house exam development team led by a psychometrician. And so they really facilitate the process. And then psychometrician,
that's someone who has actually gone on and really did a deep dive into statistical analysis, how to get false positives and how to recognize them. So this is a scientific way to build a competency testing examination.
Yes, 100%. Everything we do has some science behind it. And I think that's what continues to allow our exam to be recognized as one of the most valuable credentialing, high integrity type of programs that exist out there today. We also support the board with many volunteers who serve as consultants to our exam committees. So others who bring content expertise to the table to help. Item writers, individuals who
item writers. I know what that term means. Why don't you explain to our listeners what an item writer does?
So an item writer, we will give them a specific assignment and say, we need a test question developed in a particular domain. And we give them that assignment and they'll write a raw item for us. So the STEM and the 4 options that someone could potentially select from and the correct answer. And then we pay $25 for each item that we accept to those volunteers who want to participate in that process.
Now, you mentioned you want the exam in one of the 3 domains, and I understand what that means, but our listeners might not. You have basically a recall question, which is very straightforward. Then you have an application process of the information in that item, and then you have the analysis. And so you're really giving direction to these consultant item writers in terms of not only the topic, but what type of question you're looking for or item you're looking for to meet those requirements.
Yes. And so we tell them we want it to be in a certain area of the content outline, at which cognitive level, recall, application, or analysis that we want it written, and then give them some guidance, but ask them to create that raw question. Once we get that question, the committee's going to tear it apart, but it will be something that we use kind of as the basis for development of a question that could appear on an exam.
Back when I was in graduate school, I actually took a measurement and evaluation. One of the points was you always want questions to be not only valid, that is, they ask exactly what you want it to ask, but it has to be reliable. It has to do it over and over and over again, not just once or twice, and then the rest of the time people get it wrong. So you also analyze the performance of these items retrospectively after the exam.
We do. We look at them retrospectively, but we also look at them prospectively. So we are pre-testing items before they go on a scored form of the examination. And that's how we provide instant scoring at the test center. And so we're looking at that data really before it ever gets on a form of the exam. And we're pre-testing items for about 2 years. So we have good, solid data to look at. And then we do look at statistics after the fact, but we're doing, it's changed since we did paper pencil testing back in the day. We do pre-equating. So we equate the exam prior to administering it. And in the past, we used to look at that data after the fact.
We'll talk more about the testing. It's very convenient and it's very timely compared to the old pencil and paper. We had to make an appointment. I'd like next to spend a few minutes discussing how the NBRC goes about ensuring that its exams effectively determine clinical competencies, especially in respiratory care, which would be the CRT and the RRT credential, and also in pulmonary diagnosis, which would be the certified pulmonary function technologist or the registered pulmonary function technologist. Now, the first 2 will focus on the RRT and the CRT. How do you determine that test is actually going to determine if this is a competent individual to practice?
Right. So again, we start with the job analysis. We do a survey of practitioners who are already serving in those roles as CRTs and RRTs. We collect data about what tasks are being performed on the job. We look at how frequently they're performed and how important they are to the job. And then ultimately, that's how we create the detailed content outline and determine what we're going to test. we can't test the entire domain of respiratory care, or someone would be sitting there for days taking an exam. And so we look at things that are most important to the job and most frequently performed on a nationwide basis.
So now, how many people received this survey? Approximately how many people?
So we will send it out to tens of thousands of people. We like to see a response rate of at least 20% or so. And we get that. And that's how we ensure the validity and the reliability of this examination program, the response rates that we get, and then how people perform on the exams.
So it's not just sent to managers and educators, it's actually spent to practicing clinicians as well. How about physicians? Do you have physicians involved in that survey?
We do. We have the physicians that serve on our board, as well as others from those sponsoring organizations participate as well. And
that's done, you say, every 5 years you have to redo the job analysis. And is that your determination, or is that from someplace else that you have to comply with?
NCCA suggests that. They don't have a hard line in the sand for us, but we feel that 5 years is about the appropriate amount of time. Really, by the time we get done with one and implement, we're starting another one already.
And in that time frame, you can capture all new developments in practice that actually apply them into it, which I think is really a very good time frame for that 5 years. Now, how do you ensure, you mentioned it earlier before we started recording, about ensuring that the test items from test to test are actually measuring what they purport to measure. Get a little, again, more about how you would do that analysis of the item writing and the response rate.
Sure. From the job analysis, or would you like to hear about when we look at test scores?
Test scores.
And reliability.
Yeah, right.
Mm-hmm. So we're pre-testing first. We're pre-testing to ensure that those items are performing like we expect they would perform. And then we score them, put them on a scored form of the exam. Individuals take them. We do look at interim item analysis. So as those tests are being administered every single day of the week, once every 3 months, we're looking at data to ensure that those items are performing like we think they should. If there's something that raises a red flag for us, then we'll note that. We'll take that back to the committee. If they don't think it's substantive, we will leave it on the test. If they are like, well, this really doesn't have a correct answer, we'll pull it off the test. We'll replace it with something else. So it's not a develop it and let it go. We are dynamically looking at data and statistics throughout the life cycle of the exam.
And I guess that leads me to the next question. How many states now use the CRT or the RRT as for de facto licensing examination?
49 of the 50 states are using the exam, as well as the District of Columbia.
Now, I think that pretty much shows that they think that the state regulatory boards think that the NBRC is obviously quite competent in what they're doing. Is that why you maintain such a great association with the Institute for Performance Improvement and also the National Commission to basically kind of give yourself that credibility?
Yeah, I think that's one thing, and back in the 80s, the board developed a resolution that said, we'll let our exam be used by state licensing boards for this purpose of initial licensure. And we've done a great job of maintaining those relationships with the states as states were getting licensure in the 80s and 90s and early 2000s. We were there to assist them and help them because it's very costly to start.
Oh, absolutely. Yeah, I think that if the states had to do their own examination and then you'd have a problem with transferability between states, it would just be cost prohibitive because you have all the requirements legally required to make sure it's competency testing.
Right. Now, we mentioned they really went away from using the test to just recognizing the credential.
And I think that's important because that really gives a validation that what we're doing is respected both in a legal sphere as well as patient protection, because the whole purpose of licensure is to protect the public welfare, is not to promote the respiratory therapy profession.
Absolutely.
That's their own responsibility. Now, we mentioned the CRT and the RRT are required for obvious states. Some states require the RRT, some require the CRT, and that's changing. What about the credential for the pulmonary function technologist or the registered pulmonary function technologist? Are they necessary to work in pulmonary function diagnostics?
They're not required. However, some labs some employers will require them, but it's not a requirement for a license to have those. We would love if that was the case.
Sure.
But I think that we try to ensure that employers are recognizing those credentials as much as they possibly can to denote that competency and that level of expertise that one has when they're working in a PFT lab.
Yeah, that leads me to the next area, which again is not required by state, which is the specialty credential. But you pointed out something that's going to be very obvious. With specialty credentials, each institution can put into their job requirements what credentials they expect the qualified candidate to possess. So although it's not state required, the institution has the right to determine competency. And I think that's a very important point when we get on to the next subject, which is all about these specialty credentials above and beyond what I would call the entry-level ones. First of all, there are 5 specialty credentials offered by the NBRC. What are those real quick? And we'll talk about each one in sequence.
So our specialty areas are pulmonary function technology, adult critical care, sleep disorders testing and therapeutic intervention, neonatal pediatrics, and asthma education.
And how do you determine, now these are all above and beyond the entry level, how do you know that we need a specialty credential in neonatal pediatrics or adult critical care? How do you know that?
Well, we don't necessarily know it. We have to have one of our sponsoring organizations ask us to evaluate the viability of developing a specialty credential. And so that's how with the exception of the asthma educator exam, each of these went through a viability study at the point in time when we were asked to look at it. And that would determine, is this a viable credential? Is this a viable specialty area that we should investigate? And then we did a personnel survey. Are there enough people who would earn this credential to support an ongoing credentialing program? And then we look to develop, the board makes a decision at each step of this process. And then we would do a job analysis, which we've done.
Same process that we do for the other ones once we get the approval. I think that's important because people say, well, let's have a specialty credential in leadership. Let's have one in statistical analysis. And you don't just make these up. You wait until the sponsoring organizations, as you should, say, you might want to take a look at this.
Right.
Now, let me just ask you, and this is off the top of my head, the new thing on the block is the APRT, the Advanced Practice Respiratory Therapist. Have you been approached by ICE-CPP or the AARC to take a look at maybe offering some type of exam in that domain? And if that's privileged information, I appreciate not saying too much about it.
No, I think that, we've been working with all of these organizations around the development of APRT now for almost 15 years. And APRT now has momentum and it has legs and it's growing. We have developed an outcome assessment for APRT that the accredited education programs that are offering an APRT program can use to document competency at the end of a program.
Now, is this in cooperation with COARC, the council, the accreditation agency for schools and training programs for respiratory therapists?
So the 3 organizations all have kind of our hand in the development of APRT. COARC developed the standards. AARC is obviously promoting this new job role. And then we needed to have something until we have enough people to really create a high stakes credentialing exam.
Right.
We needed kind of an interim step, something that could document someone's competency at end of their program.
Right.
And so COARC and AARC and us talked, and we decided this would be the best way to do that.
Right.
What I think this allows, though, is for us to pivot very quickly when the time comes for a high stakes credentialing exam to be done.
Well, we're seeing an awful lot of interest. I wanted to point out that the organizations, your physician sponsors, the AARC responded in turn to the American College of Chest Physicians several years ago saying, we need more of you advanced practitioners because people are not coming into pulmonary critical care medicine. So we're losing people. We need you advanced practitioners. And that's a nice way to respond. Just like the NBRC does not go out and say, we're going to have a specialty. You wait till you're approached in a proper sequence. And that's why I'm really excited about this, because the physicians are the ones that asked for it. And now we see even a greater looming shortage of qualified physicians for family practice. And the APRTs that are out there are actually working in medical practices and really kind of being a true physician extender. So we don't know where this is going to go. 40 years ago, I would have been in that class to become an APRT, I'll tell you. Now, listen, what are some of the advantages of attaining a specialty credential? What should therapists think about? Okay, I got my RRT. My God, that was hard. What should I think about now in terms of going to a specialty credential? I'm working in the ICU and it doesn't seem to help me, but at the same time, what if I want to move? What if I want to move to another facility? So what are some of the advantages career-wise that you hear people talking about the credential, the advanced practice?
I think the biggest thing that we hear is about career ladders. So a lot of institutions have career ladders set up for individuals to progress. You know, they start out as a RT on the floor. They want to move up into a supervisory role or specialize, whether it be in neopeds or in adult critical care. And the specialty credentials really allow them to demonstrate a higher level of expertise, to hopefully earn higher compensation. And there are many examples of institutions paying significantly more per hour to individuals who hold the specialty credentials.
Notice we also said earlier that it's probably sometimes being built in now to the job qualifications, responsibilities with human resource, and hospitals can do that. And they can deny applications that don't meet the qualifications. It's not state required, I should point that out, but it is a voluntary pursuit. What are basic qualifications if I wanted to take the ACCS, the American or the Adult Critical Care, or the Pediatric Specialist?
So for the ACCS, you have to hold the RRT credential for 1 year before you're eligible to take the exam. And for NPS, you have to just hold the RRT credential in order to take that exam. And I will say regarding NPS, most children's hospitals now are requiring the NPS for employment.
Yeah, I've noticed that.
Kind of becoming the standard across the country.
What about this sleep disorder specialty exam, SDS? That's really an area where we have overlapping responsibilities with another organization, which we'll talk about. But why did the NBRC decide to go down that route? Obviously, the AARC approached you for doing this.
Yeah, I would say it was a little political at the time when we were starting to develop that. There was some folks were trying to make inroads to license polysomnographic technologists. I will say that that didn't really happen the way that they anticipated that it would. But we did our duty and did a viability study and looked into the development of a sleep disorders testing examination. Ours really focuses more on therapeutic intervention, however, where the BRPT's exam is more really about the testing aspect of it, more technical aspect of it.
And we're the ones that have to make sure that if the patient is diagnosed properly, whether it's in our lab or another lab, once the appropriate therapy is prescribed, the biggest challenge, and you see it to this day, is get the proper interface between that device and that patient. And that's got to be individualized, personalized, and not just one size fits all.
Exactly. And then, helping follow that patient and compliance and all of the things that go along with that as they get put on whatever therapy they're going to be on. So I think, our exam is really developed for respiratory therapists. Could it be used for other disciplines? Maybe at some point. We kind of talk about that internally. But for now, it is solely for respiratory therapists. CRTs or RRTs are eligible to take that exam.
That's an important point. So the certified respiratory therapist and or the RRT can take the specialty exam. And depending upon how they pass, they either get the CRT or the RRT, sleep disorder specialty.
Right. For CRT, you have to hold the CRT for 6 months before you can take the sleep exam. And if you're an RRT, you have to wait for 3 months before you can take the sleep exam.
And this is not required, as we mentioned, but are you seeing anything about, for example, the Joint Commission comes around and they're going to be looking at the qualifications of the individuals in this distribution company, this DME company. Do they look favorably upon having that specialty credential in sleep disorders for the people employed by the organization?
Yeah, we're starting to hear more about that. And again, just as hospital institutions have requirements to have credentialed practitioners at the bedside, we're starting to see that with DMEs and other employers requiring a specialty credential in order to gain employment.
Yeah, I had one of the questions here. You already answered it. The difference between what the Board of Registered Polysomnography Technologists offer, they focus more on the testing, and that the respiratory therapist who takes this exam will focus more on actually applying the equipment that's prescribed by the physician to treat the diagnosed sleep apnea.
Correct.
Although that's not to say that a specialty credentialed respiratory therapist in sleep could not do testing. They could certainly competently do the testing as well. Sure.
there's still a component on the exam that focuses on that, but it's really more the treatment.
Now, let's take a look at this ever important asthma educator specialist, the AE-C, especially with the growth of asthma in the inner cities and pediatric asthma. That I'm seeing more information every day on social media about the importance of asthma education, especially in the inner cities. How did we come about doing this credential?
So this is a little different. This is a credential that we acquired rather than develop from the ground up. This credential was developed by the National Asthma Educator Certification Board about 25 years ago. I actually had the pleasure of working with them in another capacity back then. And so I knew their program. And they were a volunteer-run organization. And a few years ago, they approached us and said, we really can't keep this alive. Are you interested? And so I talked to my board president and said, sure, let's take this on, because it really does fit. You know, it is a complementary credential for respiratory therapists. But what's unique about it, it is multidisciplinary. So it is not an exam just for respiratory therapists. There are about 15 different disciplines that qualify for the AEC credential. And as you said, asthma it's everywhere. We see communications about it everywhere. And we see, you know, athletes with asthma, and we see older adults with asthma, and we see small children with asthma. And so we've really got to be able to help create qualified people to help educate the patients about how to manage their disease. And that's really what these folks are doing.
This is your first step into chronic disease management. And of course, it's so important because it is a chronic disease with scary episodes of exacerbations and then months and months of just total normal health. And that's where people get sucked into this kind of a laissez-faire, don't worry about it. But then when it happens, it happens. And that's why it's so important for the asthma educator to really hone in on what are some of the early signs, some of the early signals that you might want to call your physician and not just sit back and wait to the 911 call.
Exactly. And so we are marketing this program not only to respiratory therapists, but to the other disciplines as well. And we've become involved with the Association of Advanced Practice Pulmonary Providers and others, though, that we ensure that the people that are providing this education to patients and families all have been competency assessed through this program.
Yeah, and I no question that since you inherited the exam, you now own it. It follows the same process of the job analysis and the structure that you follow to build a valid, reliable testing competency exam. Now, how about applying for taking an NBRC exam? Let's do the best and quickest way to apply. I'm now motivated. I listened to this and I want to start thinking about getting my ACCS or my NPS. How do I go about doing that?
So the easiest way is to log into your practitioner portal, the NBRC practitioner portal, and it will tell you what exams you're eligible for. So if we already know you're an RRT, and if you've been an RRT for a year or more, it's going to tell you when you log into your practitioner portal that you're eligible. You'll click a button, you'll apply, pay, and go and schedule your exam right away.
Okay. The nice thing, I did spend much time on the NBRC website, and I must tell our listeners it is extremely user-friendly and just more information than you could ever imagine. It's just a matter of finding out the log and the hit, and it really does offer. You also offer some specialty practice exams, if I'm not mistaken.
We do. Every specialty examination has an associated practice exam. It's a full-length practice exam. And so it really mirrors what someone would see when they sit down and take the high-stakes credentialing exam.
How often are the exams available for someone who now wants to go ahead and take their entry-level exam or a specialty exam? How often are they offered, like quarterly or weekly or monthly?
Every day of the week.
And how does that work? You have a testing agency, obviously, you're working with.
Yes, so we work with PSI. They are our testing agency, and all the exams are administered on computer. So it's really a seamless, when you log on to apply, you'll get transitioned over to their scheduling system. You pick a location and a day and time, and usually you can test within a week of when you'd like to schedule your appointment. So it's really easy, painless.
How many testing sites do they offer nationwide?
There are about 400.
Wow. So it's really accessible, not a lot of travel involved, depending upon where you live. That's great.
Correct.
Now, how long does it take to get the results back? It usually take 3 or 4 months when I was back in the day getting it.
Not anymore. You get it that same day. So after you're done taking your exam, you'll answer a few questions for us about your experience, and then your results will appear on screen. And then they'll also be emailed to the candidate's email address on file with us.
Now, if that's the credentialing exam for state licensure, is that also sent to the state licensing board of the respective candidate state?
Yes, the states have access to all of that information. We have a portal specifically for the states where they can go and run their own reports. If a credential verification, a separate credential verification is needed for a state or an employer, the practitioner can also order that directly through the practitioner portal.
It really is a very efficient system. And of course, it has to be because we don't want any delays of people taking the exam and then having to wait till they get it to get back into the practice because we're running short of people, as you well know.
Exactly.
Well, you've done a great job of telling us where we are today, but at the same time, the NBRC is never standing still. And you have something in the pipeline. You have some new ideas and some new processes that you've recently announced about the CRT and the RRT competency exam starting January 2027. Why don't you kind of tell us what this is all about so people can anticipate and prepare?
Okay, so currently one has to take 2 exams in order to earn the RRT credential. We are streamlining that process, hopefully to limit the amount of time from graduation into entry into practice by combining that into a single multiple choice exam. So
that means, for example, if someone takes the written exam now and only gets the score for the CRT, but that state requires the RRT credential, they're going to have to wait and take the clinical sim to get.
Correct. Right now, you have to take the TMC and the Clin Sim. This new exam will be a single multiple choice exam. It will have 2 cut scores. If you pass at the low cut, you earn the CRT credential. If you pass at the high cut score, you earn the RRT credential. It will still assess breadth of knowledge, or what the TMC covers, and depth of clinical judgment, what the Clin Sim exam covers. But it will all be straight multiple choice. All the questions will be intermixed. You won't know if it's a breadth of knowledge or depth of clinical judgment question. There'll be 160 items plus 25 pretest items, 4 hours to take that exam. Again, instant scoring because we've
we'll talk about that pretest, those 25 pretest questions. Where do I have access to those when I take the exam, or online before I go to the exam?
Nope, they're all intermingled with the test. And so we're just pre-testing for future use. You won't know if it's a pre-test item or a scored item.
So you're kind of running it up the flagpole to see if it has validity. Sure.
That's
nice.
how we do our pre-testing.
Sure. Way to go. And the other thing is, now, what will the new exam be called? It's no longer going to be just a clinical sim. That's language is gone now. What's going to be the name of the new exam?
The respiratory therapy examination.
Okay. And that's basically primarily for licensure purposes and entry into practice competency.
Correct.
It sounds like a nice change. I know a lot of people really had trouble with the clinical simulation, and those questions are hard to build too, I must say. All right. Well, you've done a great job, and I really appreciate you making it very easy for our listeners. First of all, what is the best way to contact the NBRC?
So there's 3 ways you can contact us. You can call us at 913-895-4900. You can email us at info@nbrc.org. Or you can live chat with us via the practitioner portal and on our website, Monday through Friday, 8:30 to 4:30.
And you also, when you go on the website, you have an opportunity to chat with somebody in the office to try and at least focus in on what you're looking for.
Yes, that's on the website and in the practitioner portal. You can live chat.
Right. Now, looking at, does the NBRC present lectures or at conferences, or are you available as an exhibitor? I mean, how can people see the real live people in the NBRC?
Yes, we are on the road a lot. We are at AARC's Congress and Summer Forum. As I mentioned, we're at the Advanced Practice of Pulmonary Practice Providers Conference, the Asthma Educator Conference, and then we present at about 25 state society meetings per year. We send out a solicitation at the beginning of each year, and we self-sponsor, so we're happy to present at state meetings of respiratory care societies. So
you reach out to the State Associate Program Committee and say, look, we have people available. If you want to put a spot on your agenda, we'll be happy to be there. It won't cost you a penny.
Exactly.
That's great. Great way to give back. You also give back in terms of scholarships, and you also allow your employees, which I point out, to support some of their philanthropic organizations that are not necessarily respiratory care. Why do something like that? I mean, that's really a very powerful argument about your humility and the way you look at the whole job. But here you're allowing your staff to financially support some of their best laid, enthusiastic philanthropic organizations.
We believe it's important to support the community that we live and work in, and in the greater Kansas City area and outside of that. And my team has a very diverse perspective. And so we just feel like it's very important. It's part of who we are as an organization to give back. And so each staff member, I give them $250 a year to designate to a philanthropic cause of their choice. And so it's really nice. And I think it's just a great way for our staff to stay connected with the things that are important to them. But we also give back, as you know, significantly to respiratory care.
I was just going to mention, you also are a big supporter of the American Respiratory Care Foundation, or the foundation as it's known. That's another one of those you're giving back to the profession in this respect.
Yes, we give back through endowments that we have with the American Respiratory Care Foundation. We've given direct scholarship dollars to the tune of $6 million to education programs over the last several years. We support the American College of Respiratory Therapy Education with scholarship dollars towards individuals who want to earn PhDs, who want to become educators. That's very important to this profession too. Like we need
absolutely right.
Bedside. We need more people to teach the future generations.
Yeah, and the future there, because with the American College, the primary obstacle is a lot of people wait early on in their career and they just say, I'll get around to it. Then they want to go on and get a job in an academic institution. They find out, well, the minimum requirements of master's degree. Yeah. And you find out, well, I waited too long. I should have gone. Have you ever had anybody approach you about getting a credential for educators?
We have not. I could see something, not necessarily through us, maybe a micro credential, maybe a certificate, something like that, being created over time. I think that as a high stakes credentialing exam, that might be a tricky one to develop and to support.
Sure. Yeah, most of the academic institutions have their own requirements in terms of academic preparation and skill, and you really would be fighting against that if you did that. But, these are things that people ask me, and I just want to make sure they have an opportunity to ask you. And again, let's give that phone number out again. The phone number for the NBRC is
913-895-4900.
And then the web address is?
It's nbrc.org.
And there are all kinds of portfolios up top that you can click on to get the right opportunity that you want to identify. And the practitioner portal is the one that really is the one for the individuals.
Yes, for those who are eligible to take an exam or who already hold a credential and are doing their credential maintenance, that's your one-stop shop. Mm-hmm.
So the NBRC can offer an awful lot of support. You don't have to go out and go to one of those exam preparations. You can actually look at the NBRC website and look at your own curriculum in your educational facility and get ready for this. Well, Lori, thanks so much for taking time to spend with us today. This brings us to the end of another episode of RT Matters. We want to thank Lori Tinkler, our guest, the CEO of the NBRC, for a insightful and meaningful conversation. Now, remember, we always want to hear from you, our listeners, just about what you liked about this episode or others and what we can do better to make RT Matters work for you. And also, any requests for additional information on this or any other episode, just reach out to me. You can reach me at feedback@rtmatters.com. feedback@rtmatters.com, and I'll be happy to get back to you with any information you request. RT Matters is now the virtual voice of RTs everywhere, so please allow your fellow therapists to know about us. Now, in the meantime, go out and be the best possible RT you can be, because our patients deserve nothing less. As a highly skilled, licensed healthcare professional, we expect nothing less from you. So until next time, be kind to yourself, to others, and remember, RTs do indeed matter. Take care, be safe. When all else fails, choose to be happy.